A nurse is a caregiver. A nurse is a promoter of health. A nurse is the one that ensures that all health issues are well attended to.
An educator, and as a nurse, we never stop learning to provide great and current medical attention to our patients, to our staff, our clients, and our colleagues.
We have a lot of roles that a nurse can fit into. They can be an advocate to a sick patient that is not able to speak for themselves. A nurse is a carer.
Nurses have really impacted my life. Ever since I was little, I've always had the cause to go to the hospital, and they are the ones that have been taking care of me, making sure that I gain my health back. Even recently, they impacted my life, especially last 2 years. Those in fitting, they stood by me, they ensured I got adequate care, and this really made me, appreciate them. And this is not just the only time they've helped me one way or the other. Each time I have any issues, I come to them, and I really appreciate them. They've been wonderful.
Nurses are actually angels sent by God and are performing their functions as humans. Fortunately, my mother is also a nurse. They are so loving and caring. Each time we have issues, they are ready to follow up and follow through to ensure your well-being.
Right from cradle to this stage of my life, because at the point of birth, it was the nurses that gave birth to me. So while I was in secondary school, I was away from home, I was in secondary school. The nurses always care for us in absence of our parents. Then in my university days as a student pharmacist, I have a lot of experiences working with nurses during our clinical posting in the Benin metropolis. So I cannot really overemphasize my relationship with the nurses and how caring they had been.
Nursing job is an act of humanitarian service. The beauty of it is when you help life come to existence and you see that life grow. Your experience in nursing is always useful outside your work environment. You'll be glad to help anytime there is an emergency medical situations, and you'll be the one that will bridge that gap between life and death. It's interesting. That's the beauty part of it.
When my wife gave birth, I could see this fellow, a lady, beautiful nurse, going up and down, assisting the doctor all through the process. Now, it took them about, when they went into the labor room and till the time they delivered, okay, it actually started about 8 a.m. in the morning, and we left there at about, the delivery was done at about 9 p.m. I could see somebody so tired, but yet tender. I could see somebody so exhausted, yet dedicated. So the moment she gave me the baby in my arms and she smiled at me and said, "Hey, you have a baby," I was like, "Wow, you are a superhero." So it was really there for me. They are making a lot of difference. They are fantastic people.
My experiences with the nurses has been a very good one, because let me start by saying why I would say that anyway was the fact that I have 3 babies and they were all through CS, cesarean section, and the nurses has been very supportive. I would say they even added to the fact that I spent a few number of days at the hospital, to get discharged and then go back home to join my families.
Nurses are some special kind of people that God created after his own art, because they are the one that I can call go-to person. Before you think of saying you want to see a doctor, certainly you must see nurses, whether in your regular hospital or even in your houses. In our various houses, our first go-to person when you feel unwell is to talk to a nurse. So for me, nurses are they play an important and vital role in human existence that cannot be either quantified or do away with. So they are beautiful people. Like they used to say, nurses are beautiful.
Challenges with nursing job, we have a lot of challenges as a nurse, especially we that work here in the company. Our roles as a nurse here, let me say, is wide. Like we are following up on the patient's well-being, monitoring their drugs, how they are seeing their consultant, taking care of their BP and so on and so forth. But suddenly you just see them that they will deviate away from normal. Maybe by normal, they will leave medical care and start sorting after herbal care. They will not be telling you that it's not medical issue, that is a spiritual, is an attack. Before you know, they will go back to ground zero and we have to start all over again.
Challenges faced by nurses include being exposed to germs and diseases. They at times are abused, they are vulnerable to attack. They face psychological and mental traumas, especially when they see a patient die of some terminal illnesses that they can't do anything about it.
A lot of people feel nurses are angels and they are not meant to be healed. But due to the nature of the job and the consumption of time and all of that, they can easily fall ill if they are not taking care of themselves. And then mentally, it is draining, especially for those working in hospitals and on the field, so to say, because they deal with different people and they are short-staffed. So it can be very draining for just a nurse or two to nurse, for example, like more than 10, 20 patients.
Nurses are quite important in the healthcare delivery system. Most of the time, they are the first line of medical personnel you meet when you have medical issues. Even for those people that really want to test whether they are in good health condition or not, they are the first line of people. By so being in the front line, they face a lot of dangers. They are the first to be confronted or to be met with whatever hazards any patient is coming up to the hospital with. And if you also look at the number of cases they take care of before people even have opportunity of being in any hospital, they do a lot, either in their private practices or in public practices. Okay? They do quite a lot and they are highly instrumental. How many doctors do we have in Nigeria compared with the kind of nurses? You also have some hospitals, especially in the northern part of the country, where I don't want to mention any particular state now. A general hospital has a maximum of one medical doctor. The rest are nurses, and they are giving adequate healthcare treatment to the teeming population of such states. I dare say that about 70 to 75% of states in the northern part of Nigeria has one doctor per general hospital. The rest are nurses, and they do a lot in maintaining and taking adequate care of people's medical needs. Therefore, they are that important, and I dare say that no nation can do without them. No community can do without them. No institution can do without them. Even in our own environment here, I make bold to say that we cannot do without them, given the kind of services they render to our people. On the last note, I would say nurses are quite instrumental to nation building, right from the family unit to the community, to the state, and the federation at large. I commend them. I salute their courage and also their level of expertise, especially in the medical space. I want to congratulate all the nurses in Nigeria and the world all over.
This is just to appreciate our nurses at FITSEN and nurses all over, Nigeria, all over the world for all the hard work, that they put into taking care of people's healthcare needs. At FITSEN, I'd like to just truly appreciate the nurses, Nurses Jane, Miriam, Desola, Kate, for all that they do to ensure that, staff at FITSEN get the best healthcare available. They often go all out, even sometimes to their own detriment, They're trying their best to ensure that people get good access to healthcare. Sometimes they are also not feeling too good, but they have to put their needs aside to address other people's needs. So just to appreciate you, to say that everything that you do at FITSEN, it is well noted. We love you, we thank you for all that you do, and we know that it's not done in vain. All the best. Happy International Nurses Day.
On this auspicious occasion of the International Nurses Day, I can only wish our nurses, starting from Nurse Jane Akamadu, Nurse Miriam Alao, Nurse Adesola Iriwe, and myself, because I refer to myself as an official member of the nursing team. Maybe they are going to give me the title of auxiliary nurse now, I don't know. I want to wish all of them a beautiful and happy International Nurses Day. It's a beautiful career that they have chosen for themselves, and I know, right, that they are doing very well for themselves. They should just carry on and keep caring for us so that we can care for others as well.
Happy International Nurses Day.
Happy International Nurses Day.
Happy International Nurses Day to all the nurses around the world.
Keep doing what you're doing. I want to wish you all the best. Happy International Nurses Day.
To all the nurses in the world, I say Happy International Nurses Day.
I wish all of them Happy International Nurses Day.
As a nurse, I want to wish all of us Happy International Nurses Day.
Happy International Nurses Day.
Happy International Nurses Day.
Nurses are lifesavers. Keep saving life. And happy International Nurses Day to all the nurses all over the world. God bless you.